Advanced care planning is reflecting on your personal values and beliefs around wellness and illness, then sharing them with the people that are important to you and your healthcare team. These values and beliefs can be honored if a medical decision needs to be made on your behalf.
Whatever your age or stage of health, advanced care planning is important because life is unpredictable. A health crisis can occur at any time. In a health crisis, when your family or medical team needs to make decisions on your behalf, having a plan is important so they can be your ambassadors. Instead of making decisions for you, they're communicating your wishes. An advanced care plan is often a written document, but it doesn't have to be. In this video, we want to help you start thinking about making an advanced care plan and how to talk about it with your loved ones and your care team. It can be hard to get started, but many people find it rewarding to have these conversations with their loved ones early. There are a lot of resources to help you work through the details, how to specifically communicate your healthcare wishes. You might want support through a loved one, elder, healthcare provider, or someone else important to you. There are booklets, websites, and healthcare providers available to help.
Take a moment to reflect. Try asking yourself these questions. Your healthcare team can help you work through more details, but this is a good place to start. What gives your life meaning? What matters most to you in wellness and in illness? What is heart failure, and what does that mean for you as you live your life?
When you know your values and beliefs, you can make better decisions about your health care. You can also explain what's important to you to others to help them if they need to make a choice on your behalf in a health crisis. When you are well, you provide consent for your own medical treatments. If you are too sick to provide consent, another person can help make health decisions on your behalf. This person is called a substitute decision maker. It's important to take some time to consider who this person might be for you. Talk to your substitute decision maker about your plans and what matters to you. You can also tell other loved ones about your plans, and this can help create a support network around your substitute decision maker. It's important to ask for help with this part of the process. Many people choose to write down their plan to make it easier to remember, share, and update regularly. Nine years ago, I was attending a bar fitness class, and that morning I found it particularly difficult. And I started turning red, and next thing I knew, everything went black. I woke up and they were doing CPR on me, and I was rushed immediately to a hospital where I was unconscious for many hours.
I was at home with the kids and received a phone call from the social worker at the hospital saying that Tara had had some kind of a cardiac event, that she was very sick in the emergency room, and that I should get to the hospital as quickly as possible.
Yes. I woke up and my husband was standing over me, and both of us were very shocked that this had happened. I was healthy, I was active, and this was very unexpected for both of us. It was at that time that I realized that something catastrophic had happened to my heart, and it likely wasn't going to fully recover. At that time, my husband and I had never discussed my plans and what I wanted. There was no advanced care plan in place. And so we just sort of approached that day by day. Thankfully, he made decisions that I would agree with, but had I had an advanced care plan, then I think it would have been much more helpful. We have since met with Lauren, and she's gone through the importance of an advanced care plan, and my husband and I have done that together. So what was the process of doing your advanced care plan like for you?
It was helpful because this was a more thorough process and formalized it, and there was prompts and discussion topics in the advanced care workbook that we hadn't touched on prior to that. And so it helped broaden the discussion, and I think it made it easier and it made it clearer for us.
So Tara, after today and going through this process, what advice do you have for other people living with heart failure about advanced care planning?
I would say that it's really important to have an advanced care plan in place that would be less burdensome for those around me having to make those decisions for me. So I'd wish I had done it earlier. And now, you know, because of my heart failure, I would imagine that we need to revisit this more often and come back to it because it might change as my health changes or my values change and life changes. I would imagine that I would need to come back and look at this again.
Talk to your healthcare team regularly about your plan and keep updating it over time.